is critical for all of us as citizens to understand. One of the reasons why our healthcare system is going broke and why it's also making our economy less competitive is because it's so fractured. There are people that come into my urgent care center and they have 3 physicians and they're on 4 different kinds of medications. No one's talking to each other. No one even knows that they've already gotten that lab test 5 or 6 times. Then they get the lab test and which one of the 4 is going to follow up on them. You know, to expect a patient to be expert in navigating these almost Byzantine pathways of how referrals are made, how tests are tracked, is just unrealistic. Part of what the Healthcare Affordability Act is focusing on, and which we need to move forward as a society, is not only looking at outcomes and paying for outcomes, but realizing those outcomes can be much more effectively and efficiently met by a healthcare team, a medical home, where your records are there, the people know you, they're proactive. If you happen to be out of state and something happens, that information is made available to the treating physician. It can save so many medical mistakes, so much unneeded tests, and actually improve our lives and outcomes. So something isn't working. While we may have the best, we certainly haven't deployed the best. And I see it every day in the patients that I deal with, and I see it in my own family's healthcare issues as well. Well, the healthcare system we've had has been fee-driven. It doesn't matter how well you do something, unless you do it so poorly you get sued and malpractice. You get paid for doing. The more you do, the more you get paid. It had little tie to outcomes, little tie to quality, and almost no connection to prevention. Prevention and quality outcomes and integrated care that makes us more effective and efficient is critical for our competitiveness in the world economically, for my own small business, as well as for the patients that we serve. Incredibly ambitious, hardworking, and he decided he was going to be an entrepreneur and be a contractor rather than an employee. So he had no health insurance for the last 2 years. 2 years ago, he started coughing up blood. Avoided it, went away, tried to keep it out of his mind, wait until he could get his company to be successful. So he came in to see me last week, and he appears to have a massive lung cancer. And it's going to cost our healthcare system, our company, our hospitals, probably hundreds of thousands of dollars for something that might have been spotted and stopped a year and a half or 2 ago. I don't believe America's in a lifeboat mentality where we throw out those that have trouble. There is a role for government, at least as a referee, and certainly to take care of those that would otherwise cost us more, even if we're focused and self-responsible, but also just out of the basis of what America is built on, and certainly what the medical profession is built on. The AMA, several of the other national associations of physicians have been seeing for years that the system is broken. And even while the AMA has been somewhat regarded as more focused on protection of quality and physicians, they've always been strong advocates for patients, and they see that this is a win-win. Having the information at the point of decision, making better decisions so that the patients do better. It's been a tremendous boon in my everyday practice. Let me tell you how it was. How it was was people would come in with no insurance and would not be able to take the medicine that I prescribed for them or get the tests that were needed. People would come in later in their illness and would not be able to get the effective prevention and early care that would keep them alive, productive, and wonderful members of their community. Decisions were made by the insurance companies on what would get paid, how much would get paid, the amount of forms and paperwork the average physician would have to deal with would take up a quarter of their workday. Now, what's happened since the Healthcare Affordability Act in this short period of time is that the government is also giving incentives in the right direction. 4 or 5 years ago, all sides of the aisle agreed we had to do something. I feel that we have done something pretty monumental. It's not the end of the story. It's going to need to be refined and amplified, but it is such a step forward on the critical, most important problems and opportunities that we have